Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. We're doing another of our twice-weekly Facebook Lives. It's Friday, June 11th, but I will tell you this will be the last of our Friday Facebook Lives, at least for the summertime, because we're giving our staff who works here and has to do all the work getting this going, we're giving the Friday afternoon off. So this will be the last of our Friday Facebook Lives, but we'll continue to do them on Tuesdays at 6 o'clock from 6 to 7. Again, if you have questions, please put them in at Facebook questions at douglaspublichealthnetwork.org. We have a long question to start with today, and that was the best kind of question for Facebook questions. In addition, you can go ahead and put the questions in on the chat section, and we'll get to them today. But as always, we start with the situation in the world, and then we move down to the situation in the rest of the world. Well, in the world, the situation is quieting. That fourth peak, which peaked in April, is clearly coming down, and so the case rate in the world is coming down. What we're seeing is the places that previously had a lot of disease, like India, are quieting, although when I read news reports from India, not exactly clear that it's quieting as much as perhaps they're just running out of testing. So I don't know what the situation is there, but I don't think it's getting worse. But it is getting worse in other places. So you remember South America has been a problem for many months and continues to be a problem, and they really have not been able to decrease their case count despite many months of having the disease. As you know, as we're getting to our summertime, they're getting to their winter, and so it's not shocking that they might be having lots of disease, and that's a worry because I predict 6 months from now it'll start to get to be our winter, and we might see an increase in cases of disease again. In addition, there are a couple of other places that are really weird. So remember, we have talked about Africa being a place that we really worry about. We worry about Africa because they have a really poorly developed healthcare system. They don't have the ability to test. They don't have a particularly good public health system, and they've had very little disease before, so there's not a lot of natural immunity. Africa, except for South Africa, has been pretty quiet all along, but now other countries in Africa are starting to really light up. And so that's got to be something we're going to watch along the way. And then Mongolia is also an interesting place. Again, Mongolia, that little oval-shaped country between China and Russia, is having a lot of disease, despite the fact that they have a very high vaccination rate with both the Russian and Chinese vaccines. So that's something to worry about. And then the other place that I look at is the UK. So in many ways, the UK and the US have been similar in our journey through COVID. And so you remember in January and February of this year, the UK had just a terrible, terrible time with it. And then their case rate, and they got a lot of vaccinations. They actually did better than we did early on with vaccinations. They got a lot of people vaccinated. They switched from the earlier variants to the B117 or the Alpha variant, and that came through. They got rid of that, and their case count went down, and their death rate came down, and everything looked good. However, over the last 2 weeks, their case count is starting to rise again, and the UK, which has done a very good job at looking at variants, has found that the B117 variant that they could get rid of with vaccination and public health measures is now being replaced by the Delta variant or the Indian variant or the 617.2 variant. And so it's now replaced, and they're starting to see an uptick in cases. And the uptick in cases, not even. There's much of England and Wales that don't have very many cases, but then some place like Manchester has a tremendous amount of cases. So that's some place I'm watching carefully. The U.S. continue to have a decrease in cases. Overall, we're at about 4 cases per 100,000 per day, and really no hotspots. Starting to see a little bit of disease in Louisiana, a little bit of disease in the Texas Panhandle and southern Texas, a little bit in northern Missouri, but nothing really that you consider a hotspot in this country. Douglas, Oregon, we're at 6 cases per 100,000, about the national average, but Douglas County continues to be high. We're averaging about 15 cases a day, which is one of the highest places in Oregon and one of the highest places in the country. And there are a couple of reasons for that. One is almost all of this disease is happening in unvaccinated people. So when we look last week, it was something like 111 people Of those, only 1 was vaccinated, 110 were unvaccinated. This week, we have similar kind of numbers with only 1 person who was vaccinated getting sick and everybody else who was unvaccinated. So when we look at the attack rate, that is per a certain number of people over a certain period of time, how many people get sick, the attack rate actually among the unvaccinated now in Douglas County is as high as it's ever been. So it's, as I calculated this morning, 157 per 100,000 in a week. That's the high. That's just about the highest we've ever done, whereas the attack rate among those who are vaccinated is very low, one of the lowest we've ever seen. So there really is a differential between those who are vaccinated and those who are not vaccinated. Still, there's a lot of vaccine out there. We're continuing to do events. Aviva has events almost every day, and again this weekend. We had a big event last weekend. We're going to have another big event in 2 weeks. We're really trying to get people vaccinated. The number of vaccines in Douglas County is a little hard to tell because of the federal issue. Although, what I can tell you is the federal numbers and our numbers are starting to converge. Not because we're going down, but the feds, shockingly, are finding new vaccines. And so they're starting to add to their numbers. And it looks like Douglas County overall is somewhere between 49 and 53%. I will bet you our number of 52.4 remains the number in the end. But still, that's even counting the doses from the VA, counting the doses from the tribe, and it's still only 52%. We really want to get that number up there by another 10 or 12,000 Douglas County residents. And again, what we've seen is just tremendous good effect of the vaccine. All of our recent hospitalizations, all of our recent deaths have been in those who've been unvaccinated. And although our case rates are down and the hospitalization rates, thank goodness, are coming down, still there's a lot of people in the hospital and a lot of people who are really quite sick. So there's a fellow in the hospital about my age on a ventilator. I mean, that's treacherous. By the time you get sick enough to be on a ventilator, you're pretty darn sick. So we'll see. In terms of testing, we still have lots of testing out there. We added some more people to our testing, and we continue to have lots of places to get vaccine. Almost all the pharmacies, most of the doctor's offices, certainly all of the big clinics, Aviva, South River, and Evergreen, all good places to get vaccine. All right, let's get to our questions and see what we have. So this first one is, it starts with, it's more of a statement and a wish from you. It's from somebody that I've worked with for many years, somebody who's worked at the hospital, and someone who really has been a key person in the healthcare system. You know, a lot of times people think about the healthcare system and think it's the doctors and the nurses that really make this run. I'll tell you the truth here, that doctors and nurses are clearly important, but there are so many other people who work at the hospital that are responsible for making this work. So there's technicians, medical records people, the people in maintenance who keep the hospital going 24/7, the engineers in the hospital that keep the systems and the backup systems going. You know, the hospital is full of thousands of pieces of equipment, all of which are phenomenally complicated. So it really takes a lot of people working together to get it done. So this is from someone who I've worked with for a long time. So you said, Douglas County may open up when the state numbers get to 70, and there are a lot of people in Douglas County who are not vaccinated. I'm kind of paraphrasing. And then there are a lot of people not wearing masks and continue to socialize. And that is a worry, right? Because remember, the attack rate, the disease rate among those who are vaccinated is very high, some of the highest it's ever been. And then there are places that are not asking for vaccine proof. And, this person said that they got sick from somebody else. And I will tell you, many people get COVID and get over it like a bad cold. Most people actually, once you get to be over 60, as this person I think is, get quite sick. So it's like the worst flu they've ever had, and then some of those got worse. Some people got it soon after the vaccine, and that's true. So again, the vaccine works well 14 days after your last dose. really before 14 days of ear-lactose, and we're going to go over that today, it really is much less effective and much, much, much less effective when it comes to the variants. So the disease is very effective after 2 doses, the mRNA vaccine, after 2 doses, after 14 days, but we're starting to see less and less and less. So this is a person who kind of did everything right and still wound up getting it. And that's because the measures we'd had in the past, wearing masks, social distancing, were pretty good, not great. And despite all of those measures, you really could get sick. Really, the only thing which is really protective is to have 2 doses of vaccine. Yeah, so the question is about PPE in different places. And this has been one of the real disappointing things. So some people had to work, right? They had to go to work. People who worked in the grocery stores, people who worked in other areas really need to work. And what we recognize now, somewhat in retrospect, is that those public health measures of distancing and wearing masks work some. One of the things that I have been pushing for months that has gotten very short shrift is ventilation. I think we're beginning to see now the recommendation that with ventilation, that is increasing the number of air changes in a room, can really decrease your risk of disease. So for example, we looked on airplanes and you think, well, airplanes are, tight together, there must be a lot of transmission, but airplanes, because of the way airplanes work, have lots of air changes per hour, about 15 air changes per hour when you're flying. And so actually the number of people who've gotten this disease on planes is very low because there's good ventilation. So people have to go to work, really need to have protective equipment, really need to have good ventilation, and people really need to get spread out. So we're working through one now where there are a lot of people working fairly close together in a room for many hours, although they may be 6 feet apart. What we are recognizing is that when you're with somebody in the same room for a long period of time, you probably don't have to be within 6 feet. Probably just being in the same room is a risk. And this should not be surprising, right? Because when we've seen that outbreak at that choir group up in Washington, when we see the outbreak at a cocktail party, when we see an outbreak at a church and then a lot of people get infected, it's pretty unlikely that you were within 6 feet of an individual who got sick, but in many cases you were sick and then somebody who's 10, 12, 15 feet away, but there for 90 minutes or 2 hours got sick. So we're beginning to rethink our distancing. Still 6 feet and 15 minutes is kind of the idea, but it all depends upon how close you are, what you're doing, right? If you were just quiet there, that would make a difference. If you're singing or laughing, you would obviously export more particles, whether or not you're using a mask, and then how long you're there together. So a really sad story that this person, despite having done most things correctly, still wound up getting the disease. So someone says, are stats being compiled for the number of breakthrough cases in Douglas County due to compromised immune systems? So the number of breakthrough cases are people who are fully vaccinated and then get the disease. We have had so few cases. I think when I looked, there was just one last week, and then we've only had about a dozen in the whole time. So it's not really enough to look at the systems. Many were otherwise healthy people. In many cases, the disease they got was a variant. So we got 2 back today of people who were fully vaccinated, got sick, and when we found it was the variant, both of those were the alpha variant, which is the B117, which is supposed to respond well to the vaccine. So that is a little worrisome. Okay, well, let's go through a few things here while people get in there. So what would the day be without talking about ivermectin or hydroxychloroquine? So as you know, ivermectin is an antiparasitic drug, which we've used for many years. We'll use it to treat some parasitic infections, some things serious, some things not very serious, like head lice. And some people have suggested that ivermectin is a wonder drug that is going to totally change what happens with COVID. And people feel very strongly about this. It seems to me to be almost a sort of a religious belief, that they believe in it, and it's hard once somebody believes or doesn't believe to go ahead and change their things. And I, in this case, remain open to the study. There are a bunch of studies that are intriguing that it might work, and then there are a bunch of studies that suggest it doesn't work. There's a group that really pushes this, and they put together all the good studies, and put together all the good studies, and it looks like it's magic. But I think when you look at the full data, it's really not clear. So medical science is certainly not the cleanest area out there. I mean, imagine you could put together, so we'll go back to a baseball metaphor. So you know I love baseball, did especially when I was a kid. And so you could put together the highlights from a team that was really terrible. So take the 1968 Mets, and you could put together highlights from the 60 games they won, and you would think they were the best team ever. However, if you didn't include the lowlights, of which there were plenty, from the 100 games they lost, you would get this unbelievable view that this team was perfect. And so when you look at these studies, you have to look at both the good and the bad. So this study was a study that was out of Israel. It was a well done study, and it looked at the viral loads in people who take an ivermectin and people who didn't. And the viral loads were a little different. And so viral loads are kind of interesting. So viral loads mean how much virus is in your body, but in the whole scheme of things, it's something that geeks worry about, but you don't really care what your viral load is, right? You just care, are you sick or not? And when they looked at the other things, they couldn't see a big difference in the groups between them. And the study was problematic. They tried to get a lot of people, they had trouble getting people, and then a bunch of people dropped out. So it was intriguing because it suggested the viral loads would be lower. And then you could say, well, if the viral loads were lower, maybe they'd be less likely to get sick, maybe they'd less likely to get really sick. And so that's intriguing, but certainly doesn't change the world. The next one is, you can't do this without talking about hydroxychloroquine. So there was a hydroxychloroquine study out of New Jersey, and it was an observational study. It looked at people who were mechanically ventilated and looked to see whether they'd taken hydroxychloroquine or not and how they did. And at least in their study, those people who took hydroxychloroquine did much better. It's a little hard to know, though, because when you look at the study, it's back from a long time ago, and the use of hydroxychloroquine was clearly not randomized. Some people took it and other people didn't. And it's so hard to know what went on. In addition, by just looking at mechanically ventilated patients from early on and later on is really problematic, because early on we thought with this disease, like with most lung diseases, that as your lungs started to slip, the best thing to do was to intubate them. And so they intubated a lot of people with this, some of which we recognize you did not need to intubate them. And later on, I think we're saving intubation only for those people who are really sick. So early on, when you intubated people who were only less seriously ill, and many were taking hydroxychloroquine, that you would have done better if you were ventilated than later on, where you only ventilate people who failed all the other measures. So it's, again, hard to know. And what I've said on all of these other things, be it ivermectin, be it hydroxychloroquine, be it fluvoxamine, which is something that actually may be more effective than any of these things, be it all those things, is there is no way for me or another doctor practicing in Oregon here to know whether these things work or not, because you will have well-respected people say, oh, you should use them, they're great. You have well-respected people say, it really doesn't work at all. You have some people say, don't do it. And so you're stuck with not knowing. Now, these studies could be done. They are not hard studies to do. They don't take 100 years to do. They don't cost millions of dollars to do. And the fact that we've not had good studies one way or another, to me, is one of the great, phenomenal disappointments of this entire pandemic. The next time we do this, I would hope that what we do is we come up with a protocol to try a drug, and we do this protocol and we test it early and rigorously early on, using not just backwards observational studies, but using a rigorous approach. In a month, you'd know the answer, and then if it worked, everybody should get the drug. And if it didn't work, then we should not waste our time and move on to something else. But again, here we are now 15 months into this, and I still can't give you a very clear answer about hydroxychloroquine. I still can't give you a very clear answer about ivermectin, and I still can't give you a very clear answer about fluvoxamine. My sense is they probably don't work. But that's just my sense. And the reason my sense is that is because there are people who I really trust who don't have any vested interest. They don't own stock in these things. They're not getting their 15 minutes of fame by being on TV talking about these things. These are scientists who really care. And those people who I trust don't really see the data that works. But again, I'm open. If we see a new great study, so for example, the study on ivermectin is going to be done at the University of Oxford using a very rigorous approach. They've been saying this for 6 months now. I don't see it. There are a couple studies on clinicaltrials.gov. Those are typically done very well. Still haven't seen any results, so I don't know the answer on that. Two other interesting things that were in the news this week. One is about the development of type 1 diabetes after the disease. This is disappointing. Type 1 diabetes means that those cells in your pancreas that produce insulin die off. And so we know that in kids this happens, and so type 1 diabetes happens. Kids are perfectly healthy, and then in the space of a very short period, their beta cells in their pancreas stop producing insulin, and they rapidly develop diabetes. And when you measure their insulin levels are very low. And if you get a look at their pancreas, which you don't usually do, you see that the islet cells and the beta cells are pretty much gone. And so it's a bad disease because once you have it forever. And since you have very little insulin, you have to give yourself insulin and monitor whatever. So it's really as a pediatrician, one of the diseases which I really, really hate. Because having type 1 diabetes totally affects your life. It affects how you eat when you wake up, having to take medicines. You can't take a day off from your diabetes. It really is a really, 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 really hard thing for kids. What we're seeing now is that people who have COVID disease, not the vaccine, COVID disease, some will go on to get type 1 diabetes. So now you've recovered from your respiratory things and all this, and now you have to deal with type 1 diabetes, so really problematic. The other big thing, it was in the front page of the Oregonian, is about myocarditis. So myocarditis is an inflammation of the heart. And so myocarditis is something that happens. It happens sometimes in reaction to some other kind of viral infections, and sometimes happens in reaction to COVID. You may remember back early on, the NCAA was very worried because a number of their athletes had COVID, seemed to get over the COVID well, but then in their physicals, they were noticed to have some cardiac abnormalities and had this myocarditis, and there was a lot of worry about that. It turns out that myocarditis that you get from the COVID disease tends not to be very severe in otherwise healthy people and tends to resolve with time, so that's the good news. But that the COVID germ, maybe the spike protein, would be associated with myocarditis was not the least bit of a surprise. And now around the world, in Israel, in the UK, and the US, what we've noticed is that people who have gotten the mRNA vaccines do seem to have a higher rate of this myocarditis. It seems to happen mostly in young men, mostly after the second dose, mostly a few days after the second dose. So they get the second dose, and then after a few days they start saying, oh, a little chest pain here, I'm feeling a little weird. And they go in and they have a test, and they do have a little bit of cardiac inflammation. Usually they just get treated with ibuprofen, and as best I can tell, almost everybody gets better quickly. So clearly a side effect to know about, that if your 19-year-old has gotten the second dose of the vaccine and then complains of chest pain, you certainly should get it checked out. But it doesn't seem to be very serious. And certainly, had you gotten the disease, the COVID disease, your chance of myocarditis would be far, far, far higher. So we would want people to look at that. Also, going back in the archives here, you'll remember we've talked over the year about the 3 different countries, Norway, Finland, and Sweden, 3 countries in Scandinavia, not exactly the same, but pretty close together, that have had different approaches. So Finland more to the east, Norway more to the west, and Sweden in the middle have had different approaches. So Finland and Norway have taken kind of, we consider the European approach with public health measures and lockdowns. Sweden has taken a more laissez-faire approach where they've not had a lot of that. Well, the differences are stark. So there's lots of different measures, but the measures that I had was the deaths per million. So deaths per million. So if you think in the U.S., we've had 1,844 deaths per million. Oregon has had 644 deaths per million. So we've had about a third of the state in the U.S. Whereas some states in the U.S., like South Dakota, has at about 2,300 deaths per million, about 4 times Oregon. And Florida has had 1,721, right about where the U.S. average is, but still far more than Oregon. And then other countries, Taiwan has had 15 deaths per million, so about 100th the death rate in the U.S. So you can see in the world that the death rates are all over the place. So early on in this, one of the discussions was, well, yeah, but you can't cripple your economy to save lives. Right? If you do all of these things, you're going to cripple your economy, and that is going to be far worse than the deaths you would get. Now, that is a hard argument to make, because then that says each death is worth a certain amount, but we're not even going to go there. But the question is, did those places that had lower death rates have better or worse economic performance? Right, so if you have more, so you could say you had more deaths and much better economic performance, and so more deaths and much better economic performance would be a conscious trade-off. And so I looked at the data. So again, remember that Taiwan had the lowest death rate. They also had the least economic input. So even though they did a lot of public health measures to control the disease, they actually had the best economic performance of all the countries. Well, Taiwan's a country, it's in China. Let's forget about them. Let's look at Norway, Finland, and Sweden. So again, Sweden had a lot more deaths, almost 10 times as many deaths as Norway. So Sweden had a lot of deaths, and their GDP for 2020 was down 3.1%. Finland had 174 deaths per million. Their GDP was down 2.8%. So although Sweden had almost 10 times as many deaths, Sweden actually even had more deaths and worse performance. Norway had 144 deaths. Their GDP was only down 2.5%. So again, you look at this, and the correlation is fewer deaths and better economic performance. So rather than the public health measures crippling the economy, it appears from this data that actually was the disease that crippled your economy. And let's look in the U.S. So Oregon had a low rate of deaths at 644, and our GDP was down, but it was down 2.8%. The U.S. had 1,844 deaths per million, so a lot more deaths and worse economic performance. South Dakota had a lot of deaths. Their economic performance was a little bit better, but they were down 1.6%. And Florida, which had a very high rate of disease at 1,700 deaths per million, they were down worse than Oregon, 2.9%. So this is all terrible. We don't ever want our GDP to go down. We don't ever want people to die. But the argument that if you do public health measures and save lives with the public health measures, you'll kill the economy is certainly not supported by this data. And if there's anybody who disagrees with me, I'd love to see this year's analysis that suggests it. Because early on, it did make a difference, right? Because early on, when you lock things down, the GDP went down a lot. And so it was a little hard to tell. But taking all of 2019 and 2020, the data is pretty clear that it wasn't the public health measures that killed the economy, it was the disease that killed the economy, and by that I will stand by that. We also looked to see what the cost of hospitalizations were. It's really a lot. So Oregon's had about 10,000 hospitalizations. Douglas County has had 327, going up every day, about 327 hospitalizations. The average COVID hospitalization cost $70,000. So that's about $22 million in hospital costs. That's a lot of costs. We also looked at the cost of quarantine. Quarantine is not free. When you tell somebody that they need to stay home for 2 weeks, maybe they have vacation, maybe they get sick leave, maybe they get something else to support it. But in many cases, not, right? In many cases, especially people who are working hourly or people certainly who are working on a commission, many of them didn't get paid at all. So when we looked at the cost of that, the cost of quarantine was about the same, about $20 million. So this was a very, very, very expensive pandemic in many ways, right? With 100,000 people, $40 million in hospital and quarantine costs comes out to a lot of dollars per people. We worry about this. This is really hurt. However, the good news is our case count, while high, is still coming down. Our vaccination rate, while not as high as we'd like to be, is going up. And I think at this point, everybody is just clamoring to get back to normal. And the best way to do that is to get more and more people vaccinated. So this week, I've talked to dozens of people about vaccination. And let me tell you the big things I hear. So the one big thing I hear is that, this vaccine, we still don't have a lot of data about it. We really have a lot of data about this vaccine. I mean, we have so much more data about this vaccine than we've had about any other vaccine that's been previously approved. We have so much data about this vaccine, so the fact that it's new, nobody knows about it, might have been true November, December, January, but it's clearly not correct now. The second one that I've heard is that there has been a concern about the effect on fertility. And so I did a deep dive on all the fertility data. There is nothing there. There is nothing to suggest that there's any change in fertility associated with this. Now, some people said, oh, well, the spike protein can get into parts of your body besides your arm. And again, that should come as no surprise. And that this spike protein with the vaccine can get other different places. Again, no surprise, but nothing to suggest that this would be any issue with fertility. So again, if you haven't been vaccinated, if you're out on the fence, please go ahead and get vaccinated now. So a few more questions. Could a COVID NAAT test come back positive for SARS cold? So there's no such thing as a SARS cold. So there's no such thing as a SARS cold. This vaccine, this testing, the NAAT test, looks for 3 nucleic acid sequences in the spike protein, the nucleic acid protein, and it doesn't cross-react with other things. It doesn't cross-react with other coronaviruses. It doesn't cross-react with other cold viruses. So if you have a Naat test which is positive, you likely have the disease. Now, if you've been vaccinated, you may have a very mild case of the disease, because that's what we're seeing is that the people who are vaccinated have very mild symptoms. So it is possible you have very mild symptoms. But I think if you have a positive test, and I don't know which test you have, but if you have a positive nucleic acid test that looks for 3 or more sequences, you probably have it. So do you think it's safe for me to fly with a vaccine to the Midwest? Well, not getting vaccinated is dangerous. This person says they can't get vaccinated because of reactions to things like that. Except if you have a reaction specifically to something in the virus, in the vaccine, you should still get vaccinated because there's some vaccine that you can take. It still is risky to travel, to do anything with when you're not vaccinated. So double masking certainly would help. The plane certainly helped, but you have to get there. You have to be at baggage claim. You have to be in line at the other things. Now the airlines have recognized how important ventilation is. So the ventilation in the terminals is also very good. So again, I never say anything is totally safe or totally unsafe. Flying unvaccinated is in the middle. Can I explain the cruise ship breakthrough cases? Yeah, everybody was vaccinated, everybody was tested, but there's still 2 cases. Yeah, this is going to happen. So again, the vaccine is great, but the vaccine is not super great. You know, it's not 100% protective. So let's say there are 5,000 people on the cruise ship. Everybody's vaccinated. So of those 5,000, presumably there are 5% of the 5,000 who are not protected. So maybe as many as 100, 200, 250 who are not protected. Everybody was tested 72 hours before boarding and again at boarding. So again, let's say you boarded on Sunday. So everybody got tested on Thursday or Friday and they were negative. And everybody got tested on Sunday and everybody was negative. Now the tests are good, but again, the tests aren't positive. So it's possible that there was 1 or 2 people who were tested who actually had the disease and it missed it. But probably most likely was that there was somebody who got exposed on Wednesday. So Thursday, you got tested. It's way too early to find it. Even Sunday is too early to find it. So Wednesday, Thursday, Friday, Saturday, Sunday. So 4th day, the pickup rate on the 4th day is not great. And so, not surprisingly, you have 5,000 people coming together, that there's going to be somebody who might have gotten exposed on Wednesday or Thursday. And those people who got exposed on Wednesday and Thursday are not going to show up on any of the tests. Even if they were vaccinated, they could still do it. Now, so here's the good news. There were 2 cases. Yay! So this was, if you asked me to predict, I would have predicted 2 to 5. I would predict 2 to 5 because that's how it works. But the story is there were 2 to 5. There were not, as with the Diamond Princess, there were not 3,000 cases. There were not 1,000 cases. There were 2 cases, and this is exactly what we'd expect. Now, did we want those 2 cases there? Absolutely not. But are those 2 cases about what you'd expect? Yes, because neither the test nor the vaccine is perfect. Now, if you really wanted to be perfect and not have this, what you would have done is you would have tested 72 hours before boarding, again at boarding, quarantine everybody for a week, test again. But for most cruises, that would kind of ruin the cruise. And so this is exactly as expected, that there'll be a few cases, that they'll come through. It won't widely spread, that the 2 people got it were not particularly ill. That is what I would consider to be success. Now, had we seen this and there were 1,000 cases, that would have been clearly a failure. If we'd seen this and seen no cases, I would say, well, that's better than expected. 2 cases, exactly what I expect. So Marianne says, how can I get a new card? I don't know what I did with mine, yeah. So we're recommending people take a picture with your phone of the cards because that, presumably they're accepting that. Everybody who got vaccine except through the VA. So if you got it through the VA, you need to call the VA and give them your name and number and they'll mail you one. They'll do a new one and mail it. For other people, you can talk to your doctor. Almost all the doctors in Douglas County are on what's called the alert system. They put your name in the alert system, bloop, and all your vaccines come up. All of the flu ones you got, your tetanus shot, all those things you got in the past. I'd encourage you to do that. So call your doctor, they can do it. If you don't have a doctor, the public health can make one up, but far better for you to just call your doctor and say, hey, I lost my card, can you make me a new one? What they get you then is a computer printout. This computer printout is considered official stuff, official documentation of all of your vaccines. So we print these up all the time for kids who want to go to college, they want to travel overseas, they want to do something else and they want to know about the vaccines. We just print it up and they get it. The cards that we're still in 2021 relying on paper cards that people write and there's no security. I mean, you could print these cards up yourself as people do on the internet. You can go ahead and write whatever in there. Nobody else would ever see it. And so the security for something so important as this vaccination, doing it the way we're doing it is just crazy. Jessica says, where can we get the vaccine on the weekend? So tomorrow you could get it at Aviva. They're having an event at the Aviva Vaccination Center. It's mostly for young kids, but Marianne will consider you young. They're going to do anybody who shows up tomorrow. So go over to Aviva. They have all 3 kinds of vaccine. So Casey says if somebody is fully vaccinated, it's been 2 weeks since, but then was exposed after 14 days, so they still need to quarantine. They do not need to quarantine. However, they do need to self-monitor. We have seen actually both of our breakthrough cases over the last 2 weeks were people who'd been contacts, and so they weren't required to quarantine, and yet they came up with the disease. So again, the vaccine is very, very excellent, but it's not perfect. So, my recommendation would be if, let's say I got exposed, so I've been vaccinated, and I got exposed. I went to some place and they called me and said, "Oh, I got it." I would quarantine because I can, right? It's because I can work from home. I would work from home, get tested on the 7th day, and if I was negative, then go back into the world because there is some risk. It's low, but up to 5% risk that I would get it. That's the failure rate of the vaccine, 5%. Still very low, that I would get it and then spread it to my friends and family, and I would never want to do that because I'm pretty healthy, but my friends and family may not be, and I would feel horrible if I gave the disease to someone else. So Casey says if somebody is fully vaccinated, it's been 2 weeks since, but then was exposed, do they still need to quarantine? No, they do not. They're not required to quarantine, but if it were me, I would. Okay, one of the other things we've been following for a long time is of our doppelganger counties. So remember, Douglas County in Oregon, Twin Falls County in Idaho, Pennington County in South Dakota, and Lowndes County in Georgia are all somewhat similar. We picked them because these are counties about the same, but a little over about 100,000 population, not capitals or big theme parks or whatever, near or on a freeway, a mixed population, and a mixed manufacturing thing. So Lowndes County in southern Georgia, where Valdosta is on a freeway. It's a small school. They grow onions. They have some wood products, so sort of not totally dissimilar than Oregon. Pennington County in South Dakota, where Rapid City is, a little different. They have a base there, a military base, which makes their population a little younger, but they have more Native Americans. Lowndes County has more blacks, and then Twin Falls near the freeway, sort of like us. So we've looked at the rates along the time, and for most of the pandemic, Douglas County actually had lower rates of disease at any one time in time, far fewer cases and far fewer deaths. Right now, our case rate is a little higher than those other areas, a little bit higher. So we're at 15, they're in the 0 to 10 range. However, the total number of cases and the total number of deaths is still way lower than any of those other areas. So we're doing okay, but we're struggling a little more now. And the question is, well, why are we struggling more now when those other counties are not? And I think it's got to be about the variants. So the variants have come in mostly through the big population centers on the edges of the country. And so New York, New Jersey, Florida, Michigan, all those places on the edges of the country had a lot of disease before. California, Oregon, and Washington has a lot of disease, and then it kind of washes through. So it may be because of that. But in general, we've been, at this point, all of the places have pretty much gotten rid of public health measures. But overall, we've done pretty well with that. Okay, well, that's all I've got for today. Let's see if there are any more questions. So again, if you need a new card, talk to your doctor, ask them to give you an alert printout. It really only takes a minute or two, and then you get all your vaccines, and it'll also tell you which ones you need. So for many of us seniors, we either need a tetanus shot or we need a shingle shot or whatever, so it'll tell you what you've had and what you need. Okay, well, that's it for questions. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer in Douglas County. I really enjoy doing these Friday sessions, but I'll be not unhappy to be done with them. So we're going to continue to do Tuesdays at 6 o'clock from 6 to 7, so get your questions in. If somebody comes through with a question, say on Wednesday, which is really timely and we need an answer right away, we'll get back to you individually, but otherwise we'll save the questions and do them on Tuesdays at 6 o'clock. It has been great to do this, and I especially want to thank the other people that have done this. So people from BP Media, especially Brian Prowitz, is doing the technical stuff. I hope it's good today. So he's doing the technical stuff. His staff helps while he's gone. And then our staff, we've had a bunch of people, mostly Vanessa Becker, who helps us getting the questions, curating the questions, and sometimes she even sends me the answers when I don't know them right off the top of my head. So especially Vanessa and Brian, thank you so much for everything you've done. And we'll see you again on Tuesday. Thank you so much.